Hi, my name's Alison Clements. I work at Nimai National in Perth, Western Australia, and I'm speaking to you from Noongar country. I'd like to pay my respects to the elders, past and present, and to the young people coming up today. I'm going to speak today about some research that I've been doing over the past couple of years on a program run by Nimai National. This is a case study on workplace postvention using funeral staff as an example. By way of rationale for this study and for the program that Nimai is developing, each year suicide impacts an estimated 135 people for each loss. That's nearly 500,000 Australians a year. And workplaces deal daily with the impact of this on both staff and clients, largely in the absence of evidence-informed, coordinated and targeted approaches which can be offered through suicide postvention. Organisations can play a key role in this public health approach to postvention through the introduction of postvention-based training and frameworks which can support frontline staff and their clients. This would improve staff and client safety, sustainability and potentially reduce community stigma, awareness and uptake of suicide bereavement support services, as well as improving communication and networking across company and industry boundaries. The design framework for this project, which started in 2019, Nimai National ran 4 co-design sessions with the staff from the funeral company to establish what their priorities and needs were. And at the same time, I started this research process, which was a mixed methods approach based on pre and post training surveys and semi-structured interviews. So in all, 67 funeral staff completed the baseline survey, which asked about their experiences with suicide bereavement funerals, and 32 of the 36 trainees completed a post-training survey. And from that group, we selected 11 to sit with me and do in-depth interviews about both their experience of working with these funerals and their responses to the training package. The training package itself was an introductory one that drew from suicide prevention and postvention research and practice. It looked at facts and myths around suicide and loss to suicide, safe language, effective communication, the issues around complex grief, and from a worker point of view, compassion, satisfaction, compassion fatigue and burnout, and looking at resilience and healthy boundaries, self-care at work, and provided some resources about services and supports for both staff and clients. With the baseline survey, which was taken prior to the training, staff said that they felt there was a level of difficulty which was much greater than on other funerals, that these funerals had a greater emotional impact on them and their colleagues, and one of the main challenges that they found was just knowing the right words to say. A thematic analysis from the 11 interviews showed that there was basically 3 things going on around the level of emotionality, challenges with communication, and the form of engagement with families bereaved by suicide. Overall, there was an increased intensity with staff really wanting to get it right for these families. They talked about walking on eggshells, wanting to make sure that they were doing the right thing for the family. In the absence of a workplace postvention framework, staff were largely making adjustments on the basis of their own experience, which was great experience, and trying to find ways of managing, like using their expertise to find ways of managing this complexity. But they did this individually and on the basis of their own experience or knowledge rather than in an organised, informed or collective manner. After the training, it was pretty much unanimous that the training and resources had been useful in working with these funerals. It helps staff better understand and manage the emotional impact of this work. and also understanding about what the families were going through, not in detail in a clinical sense, but in a social sense, and also increased confidence with using the right language. So from Mindframe and other resources, staff found that really helpful to know that they were using safe language. They were much more aware of suicide bereavement support services and, importantly, more comfortable with sharing it. One of the things that didn't change very much was the amount of pressure they felt around working with these funerals. I think that comes from basically wanting to get it right and having a sense of like the difficulties that the family is experiencing while doing their work. In terms of the post-training interviews, trainees said that the package was of substantial benefit to them. It increased their knowledge and confidence and their skills with managing the emotionality, communication and engagement with families and mourners when working with these funerals. They also said it would be useful to target the training to meet the needs of staff in specific roles. So each role has a different point of contact with the families across the process. And from administration to the funeral service itself, to the planning, and to some of the other touch points, that staff had different needs, and that the training would be really helpful to be more specifically targeted to them. And they also said that industry-related, like peer-based mentoring and informal supervision, would also be really helpful. In my conclusions, I'm seeing that these aspects of postvention, which were fairly introductory into this workplace, could be really effectively integrated into a framework which was around good practice, continuous improvement, and well-being. So a bespoke sort of workplace framework which took into account exactly what work was being done in the company and the different roles involved in that work and the different needs that those roles had. But also in terms of a public health approach, what kind of role the funeral staff might play in the community in terms of providing resources, but also just in terms of the manner in which they work, to destigmatise and help reduce the isolation which comes commonly with suicide bereavement. And yeah, that's an area for future research, as they say. But essentially, this would really require partnerships and two-way learning across organisational and industry boundaries. So really important to look at these previously overlooked workplaces with, in this case, frontline contact with families bereaved by suicide, and what's within their scope, and what ways can we help keep each other safe in these spaces and support wellbeing while we do this important work. Yeah, so that's the end of my presentation. I hope I did all the IT stuff okay. And if anyone would like to contact me, please do so. I'm interested in talking about this work and how it might be applied elsewhere. Thank you so much.